All right, so microphone is working and it's 5:30 on the dot. So we're going to start our CoC General Membership Meeting. My name is Kathleen Beckman. I am the chair of the Continuum of Care, and we are here with the assistance of our lead agency, the Homeless Leadership Alliance. So we have Victoria and Megan here that are helping to direct this meeting. I'm very happy for those who are in attendance here in person. Thank you for making that effort, and welcome to everyone who has chosen the virtual, which is wonderful too. It's good for the environment, for attending. About how many do we have online right now?
We've got 17.
Oh, fantastic.
So yeah.
All right, so we'll do brief introductions about with people that are here. What's the best way you think to do that? Do you want me to walk around with the microphone?
I have a second microphone.
Okay.
Secondary one.
Okay, so we'll have people in attendance here, just introduce themselves. Start with yours.
Evening, everybody. My name is Jerry Small. I'm on the CoC Board of Directors and co-chairman of the LEAC Committee, as well as a couple other ones, but I'm only going to a lengthy introduction.
And the LEAC committee is?
Life Experience Advisory Committee. We're the advisory committee of the homelessness concerns and wants to the CoC directly. And I carry the information directly from the committee to the board.
It's scary.
My name is Mary Robinson. I'm on the LEAC committee, been on it for about 6 months.
Thank you.
My name is Joseph Browning. I'm a member of the LEAC committee. I've been a member for about 6 months also.
Fantastic.
Good evening, Michael Marino, Clearwater City Council member. Looking forward to being here this evening with everyone.
I am Major Ted Morris, Director of the Salvation Army for Upper Pinellas County.
Thank you. Welcome.
Hello, everyone. My name is Dominique Randall. I work for Pinellas County Human Services.
I'm Claire and I work for Catholic Charities.
Darrell Henderson, Advocacy Director for the Recovery Advocacy Foundation.
Thank you very much.
Hi, Alyssa Thompson, site manager here at Feeding Pinellas.
Hi everyone, I'm Michelle Thompson. I'm Senior Director of Labor Experience at Feeding Tampa Bay. Welcome.
Thank you for hosting us. Sorry, I was just walking in for giving introductions.
Yeah, so.
Okay.
All right. And my name is Victoria Kelly. I am the Senior Manager of Advancement and Strategy with the Homeless Leadership Alliance of Pinellas, the lead agency in the Pinellas Continuum of Care. Megan?
Hello, everybody. My name is Megan Robinson. I'm a CIP planning specialist with the HLA.
Thank you. I'll turn it over to you all for the beginning of the presentation.
All right. So first and foremost, if you have not yet, please make sure that you sign in up front. Please also, if you're online, make sure you sign in the chat. We want to know who's here with us. So please make sure that you sign in. And then Megan, we can go ahead and move on over. So during our meeting today, we're going to go through a little bit of meet the team. Then we're going to have a presentation from our wonderful hosts at Feeding Tampa Bay. Then we're going to talk about the state of homelessness in Pinellas County. I always really like doing this presentation. I think it's a really important thing when we talk about the work that we're trying to do here. Then Chair Beckman is going to go through some CoC goals, and there will be an opportunity for feedback. I always think that's a really important thing to do as well in these early year meetings. Then we'll talk a little bit about CoC membership, CoC boards, councils, and committees, opportunities for engagement. And then there will be an opportunity for public comment and questions and answers. There is a public comment card. Oh, that's air conditioning. There is a public comment card up at the front. in case anybody wants to fill that out, and we will of course have those at the end. Sorry, a little bit of a delay there, I think. Okay, so now let's go ahead and talk about CoC and HLA leadership. First of all, what on earth is the CoC? That is the Pinellas Continuum of Care. That is why everybody is here today, because we are CoC members, or our agency is a CoC member, or we want to become CoC members because we are supporting the mission to end homelessness. So thank you for being here. Also, what on earth is the HLA? That's the Homeless Leadership Alliance of Pinellas. We are the lead agency in the Pinellas Continuum of Care, and we are one of so many agencies working within the CoC to try and achieve that mission of ending homelessness. I think it's really valuable to know who our leaders are. Next slide. It's valuable to know who our leaders are within the CoC. I am not going to read this slide off to you, do not worry. But if you're interested, this is a list of all of our CoC board members. It's also available online, and you can scan that QR code there to see who our CoC board members are. Our CoC board is, of course, led by Chair Kathleen Beckman over here, and our dedicated executive committee team. So thank you. We also have a few board members here with us today. So thank you to every board member who is here with us today. Chair Beckman, did you want to say something about the CoC board?
Sure, thank you. So our board, as Victoria put on this slide, we have professionals from throughout the community. We are required to have elected officials, providers, funders. So we have representatives from the county and municipalities to provide funding. And we have service providers. We have faith-based organization leaders. We have local housing authorities. We have a school board member representation. Anyone in the county who touches or interacts with people who are either facing homelessness or experiencing homelessness needs a seat at the table. One of the goals that I have, we'll have a portion of our agenda, I'll discuss the CoC goals, is to engage and think out the box about people who are engaged with the CoC. We have people from the recovery community here participating. And so we also have at-large seats. These are people who are in the community who care about working to reduce and prevent homelessness, who sit on our board of directors. We have law enforcement. So we have the sheriff's office is represented on our board of directors. Healthcare. So I know you can't read all this. Veterans organizations, hospitals. Again, there are so many different organizations that interact with people who are facing homelessness or people who are experiencing homelessness. And their voice is very important. And they're part of our CoC board of directors. And then anyone, if you're not on the board of directors, but you're here, you can join as a general member. And that's what this meeting is, general membership meeting. So anyone can be part of the CoC and do the work and advocacy, outreach, education, and actual helping to serve those who are facing homelessness. And so that's what we've got there. I'm sure we'll share this PowerPoint if you'd like it shared with you. You've got your email there and the check-in and contact information. So if you'd like this PowerPoint, we can share that with you those members. Excellent. You want to talk about your board?
You also heard me talk about the HLA a minute ago. The HLA also has a board of directors. And our board chair is Mick Constantino. We also have Secretary Pamela Pauls, Treasurer Tony Russo, and then directors Kimberly Rogers, Lee Allen, and Nick Perry. And we have an interim CEO right now, Mr. Aaron Swift. And so this is HLA's senior most leadership team. Thought it was important that everybody know who on earth we are too. All right, so that's a little bit about the CoC, a quick overview. Now we're gonna give it over to our partners who generously donated this space, who donated wonderful snacks in the back. Thank you so much, to tell you a little bit more about feeding Tampa Bay and feeding Pinellas, because no one know what our COT partners are up to.
Good evening, everyone, in person and online. The agenda says Alyssa Thomason. She is in the back there. She can be your primary point of contact for Feeding Pinellas. She's our site manager here. My name's Rochelle Thompson. We're still working via Zoom. It's also okay if it doesn't work. I can just talk. I'm gonna breeze right through this. I'm sure most of you are familiar with Feeding Tampa Bay, but I'll talk a little bit about who we are, what this space represents for us, and some changes to our strategic direction that you'll start to see a little more prominently over the next couple of years. So I've been at Feeding Tampa Bay for 6 years. My background is as a social worker. I'm very passionate about the work that you all do in the room. But Feeding Tampa Bay, I think you all know us as a food bank. So we are the Feeding America affiliate food bank, which means we have the Feeding America contract for 10 counties in West Central Florida. So anything around food rescue, food safety, getting that back out to the community. We work with over 400 partners in our area to do that work, many of which you know of here in the local Pinellas community. We estimate much higher than this. I think we have something we call food bank math, but there's no real good math or indicator of food insecurity. We have obvious food insecurity and then less obvious food insecurity. So we estimate that there's 1 million in our region, though our CEO Thomas Nance would say that he thinks that's a lot higher. Food insecurity doesn't have a specific look or image. It doesn't present in a specific way. You can have someone drive up to one of our mobile pantries with a very nice car. That doesn't mean anything, right? We've had government shutdowns, we've had a pandemic, we've had hurricanes, so food assistance and those needs can be prevalent for many of our families and households in the area. We rely heavily, as you well know, on volunteers. We have about 5,000 volunteers that we work with on a monthly basis in order to have our programs run and available to the community. So within this million food insecure, the national numbers are around 1 in 6 adults and 1 in 4 children struggle with food insecurity. That's actually how we landed at this location in the first place. I want to say 2021. Yes, because we were right next to Blanton Elementary, and there's a high occurrence, obviously, of food insecurity with elementary aged children and families. And we started back in the day like a backpack program, right? Because you give a child a backpack and then they take that food home over the weekend. But we have a partnership with USF, and we did some research that says, one, doing that wasn't effective because by Friday night, all the food is gone. Number two, you're asking a child to be a caregiver, so you're putting them in an adult role and responsibility within their household. So we wanted to think of a better way to support these families, which is why we started school pantries. So we started Feeding Pinellas because the pantry here actually serves as a school pantry for Blanton Elementary when we were looking at options within the community. You can go to the next. You can skip. Skip. I think you guys know most of this. It's basically saying that it doesn't quite matter your income. Food insecurity is pretty prevalent across the board. As I said, food bank math isn't the best, and so Feeding America has a tool called Map the Meal Gap, where we try to guess what some of that is, but their data lags pretty well behind, and so the most recent data we have is 2022, and the landscape in 2024 and 2025 is pretty different than it was 2 years ago. So our estimate is that this is way low, but here's some stats about Pinellas County at about a 13% food insecurity rate, with about 61% being eligible for SNAP benefits, which gives you like a good income indicator of food insecurity. Next. So I'll breeze through the next pretty quickly, but we had a conversation a couple years ago internally where we figured out, I think you all know this, but food alone will not solve food insecurity. So our CEO has shared a couple of times that if you look at the food insecurity rate, like the need, it is higher now than when he started 10 years ago. So he's like, what have we done to make a difference? And so if we know that providing food isn't actually the solution for remedying food insecurity and hunger, then what is the solution and what are we doing? So we're re-looking at that. We know that, right, social services across the board is a big community, a continuum of care that works together to make it happen. A lot of people opt for help with food. So if you're nervous about seeking, right, homeless services or other things, that can be harder to do. Food is a pretty low hanging fruit. So if we're seeing hundreds of thousands of people come through Feeding Tampa Bay's care, how can we be better at leveraging the interaction to connect them, right, to the organizations and places that will help more long term? So that's where you'll start to see some of our shifts, our approach change. You can change. If you visit our website recently, you'll see a little bit different language where we're talking about feeding solutions, feeding well-being, feeding humanity, and feeding connections. So internally in our strategic plan, we have goals and objectives around each of these areas to help us just be better at feeding in general. And it's not just here's a box of food, good luck to you, right? If we already know that that's not solving the issue. Next. So we obviously have our food interventions. You can go next. You guys probably know us the best for our food pantry network across the county, and then also our kind of disaster-related mobile responses. So when you see our truck out at like Tropicana Field or something like that, and we have cars come through, that style of intervention we're trying to change, because again, that's a very just transactional, here's a box of food. It's very helpful in the moment. The community really appreciates it, but long term, how do we think about that? So we save those interventions for mobilizing during a pandemic or after a hurricane or something like that. And when we're blue skies, think about some more systemic programmatic approaches. And so some of those you'll include on the next slide, I believe. You can go to the next one. So these are some of our flagship food assistance programs. So obviously there's importance for neighbors that need it to have a hot meal around a table. So you'll see that at our Trinity Cafe programs, distribute our grocery distributions. We have kind of a new market model. We're testing it on a new Causeway Center in Tampa, that it's kind of like a lab for us to test theories that we think work, so we can come out to places like Pinellas and say, actually, this is working really well. Let's adopt this here, or now when we're onboarding new partners, hey, we found a model that works a little bit better, let's try it this way. We have pretty robust FoodRx or health as medicine programs, where we work with healthcare institutions to provide food-specific care to specific disease states. So if you have a chronic condition that's related to lack of nutrition or food, then, embedding those solutions in those places. You can probably skip a couple here. So you can pause here. So ways that we're starting to go beyond food, I would say, food is the foundation of who we are, and it's how we can interact with the bigger community. But we are developing more response and program outside of that. I'll talk a little bit more in depth about neighbor services in a second. Fresh Force is our workforce development program. So we're in an active cohort right now of 20 students that we're training in culinary arts, warehousing and logistics, or truck driving. There are plenty of beautiful workforce programs. So anytime we can help get people connected who have generally barriers to access to employment, we want to do that. And we just pick those industries because they're a good career pathway and there's stuff we can train on because that's part of our business model, right? Nutrition education, we have the Department of Children and Families contract for our 10 county area in Florida, which means that we can send nutrition educators and other materials out into the community to adults, seniors, children, to provide information and education about nutrition and health. If you want to go to the next one, I'll talk very briefly about some of the neighbor services that we have at Causeway Center. We'll go to the next slide. Like I said, this is our little lab. We're trying to test some things so that we can go out to the broader community. So right now at Causeway Center, this is headquartered in Tampa, but anyone in our 10-county service area can come. Here are some of the services that we've launched to date that we're still working around growing, as well as our hours of operation. Go to the next slide. In addition to the robust kind of social service navigation that we provide in the neighborhood, we do also have our market, which is our version of a food pantry. It's sponsored by Publix and set up a little bit more like a grocery store. We also have our bistro, which is a little bit of a different version of what you're sitting in here, where we have a pay nothing, pay what you can, pay it forward model. So everyone, no matter socioeconomic status, can come in and eat around the table. And we also have our learning zone where we have scheduled monthly education classes. So I will wrap up now talking about Feeding Pinellas. So Feeding Pinellas, like I said, we've been here, I think this is our 4th year. We are heading into, we can go to the next slide, but this is our very first shoot off from like our headquarters that we've tested, where we want to see what it looks like to have a localized county solution. And we did this ahead of, we actually learned a lot from this location because we've been here for 4 years, whereas we've been at our new facility for 8 months, right? So right now we offer lunch service here, free of charge Monday through Friday. We have our on-site pantry, 3 days a week where we will see about 250 people a week. Shoppers can come weekly. We have different partners that will circulate on site. And then I think with our lunch service, we probably see about 400 people a week come in. That's probably a duplicated number. Okay, so I have some information there. You want to see more on our website. We do have coming soon that list of services has been staff dependent. So now that we're able to hire and recruit for that, we'll start to bring some of those services over to this location as well. Any questions for me, please?
Services you provide for somebody to ask somebody that's replaced not to.
Yep, so they are welcome in our buildings and in our locations, so you can come. Oh, yeah. Yeah, so we don't often do like, I hear you, because that's a very common experience. So right now, our pet food donations mostly go to the Humane Society or the pet pantry. During, like, sometimes if we get the donations in, we'll have them during the pantry hours, like after the hurricanes, we got a ton of pet food from Petco, right? So some of that is just donation dependent. But on a normal basis, the Humane Society pet pantry would be your best option. That's where that usually goes. Any other questions?
Thank you for your presentation. I have one comment and one question. You went through the slides pretty quickly about Alice, and I think it's really important to stress what Alice is and how significant it is in Pinellas County.
I'd be happy to. I didn't know, I thought all of you in the room might know, but I'm happy to. So Alice is, right, if we look at just SNAP income eligibility, that gives us one threshold, or federal poverty level gives us one threshold of what we might see as financially insecure, so hence food insecure. ALICE stands for asset limited, income constrained, but employed. So these are community members that are working hard and working jobs, but it's still difficult to make it ends meet. And that data is one of our more helpful pieces of data because our local United Way comes out with that annually, whereas you saw my Feeding America data lags 2 years behind. So we look at that a lot to say, like, yes, we have those that traditionally we may think of as food insecure, but in addition, we have a lot of working families that will fall in that. And I think there is an income threshold in every county that United Way puts out, so you can Google it, but it's usually in the 80 to 90,000 to say if you're earning that, you're still an Alice household in Tampa Bay because your income still isn't enough.
I think that's really important when we live in a tourist industry community, that these people are working full-time jobs, sometimes multiple jobs, and just they're employed and they need to go to a food bank to make ends meet. The other question I had was, you said at the Causeway Center, you had a list of different services, that you offer, you're open a variety of hours. But you had emergency housing listed there. What does that look like?
Right now, that means Metropolitan Ministries is on site, that will continue to expand, but some people can find it hard to go directly to Metman, so the nice thing about having some of these partners co-located on site is a pretty direct access point to them, so if you go on the QR code I had just on our website, people can book directly with the Metropolitan Ministries at our location instead of having to call and kind of do the whole process.
Thank you.
You're welcome.
Thank you for the discussion. I was wondering what you do in the event that someone may present at a food bank and they are in addiction and then they seek the services that way. Do you have someone on site or we looking to partner with community partners?
Both, yes, I'm always looking to partner. So, we've tested that at locations like Pinellas or Trinity Cafe where we'll have, I don't know all of the equivalents of Hillsborough to here, but I think they have similar, so like CoC Behavioral Health, for example, is in, Hillsborough, but they have an equivalent partner here, so those are new. We have a new partnership with the Crisis Center to do that directly as well. So, some of it is luckily that I have two SWs on staff so that we can, assess and respond and then figure out who the partner or next step is, yeah. But also why we love being invited tonight, because there's still a lot, right, to do around that.
Thank you for the presentation. I greatly appreciate the organization's deeper thought in going beyond just hunger, going into the underlying approaches to it. So thank you for that. Thank you for sharing. My question, and we did go kind of quick, was
Sorry, so 10 minutes.
you're fine. You're on the clock, so I get it. You identified that you served over 87 million meals last year, but a target goal for this year is 80 million. What can you explain that downturn?
One is that we saw two hurricanes last year, which we have a much denser response than usual. The other is sort of a public statement to say, to go deeper, it's gonna cause us to expend more resources doing that work. And so we have an internal goal of how much resources we want to reallocate to stuff like intervention and prevention. So, the reassessment of that meal goal to say, okay, if we are going to internally do that, what does that look like if all of our resources go instead from meals out to very wraparound type of care? I think that is why. Yep.
Thank you.
Yeah. All right. Thank you. We'll be here with the meeting, so let me know if there's anything else, but thank you all for having us.
Thank you. All right, well, Megan gets switched back over to the CoC slideshow. Thank you so much for that. That was such an awesome presentation. I always really like being able to hear from our hosts as we do these meetings, because there are so many awesome services in our community, and if we all know what they are and we all know how to refer people to them and how to access them, we are a much stronger, healthier community. So that is wonderful and exciting. Thank you so much for sharing that. I also want to notice, we're getting back up here, that the room we are in right now, thanks to our partners here at Northwest Church, with of course the support of the Feeding Pinellas team, this is actually one of our whole night shelter locations, if you did not know. This location here opens when we have feels like temperatures of 40 or colder across the county overnight, and they sleep upwards of 55 folks in this room, some nights considerably more. We serve dinner and breakfast, and it is absolutely awesome. So just felt like mentioning that as we were here. Okay. Sorry, everybody. Technology is a little bit slow today. Has anybody else been having that issue? Because it's been all day for me. Thank you for agreeing, Sam. All right. Now I want to talk about homelessness in Pinellas County. Because that is ultimately why we are all here, right? We are working to solve homelessness. The map that you are looking at on your left-hand side, by the way, is a map of the 2024 point in time count. These are where surveys were done during the 2024 point in time count. And there is a full dashboard that see links to it later, where you can actually see that interactive map and all of that data. But Megan, if you want to move us along. So here we're going to go over that 2024 point in time count that I just mentioned. We're going to talk about HUD's annual assessment report to Congress for the 2024 point in time count. The National Low Income Housing Coalition's GAP report, their most recent report was 2022. And current Florida legislation and how it is impacting our community. So the annual point in time count. Y'all may know about this. We just did this about 2 weeks ago. I think some of us, Dominique and I in particular, are still recovering. But during the annual point in time count, teams of trained volunteers here and in communities across the country go out and survey our neighbors experiencing homelessness. We do this to create a snapshot of homelessness within our community. We share this data with HUD, with DCF, so that the U.S. Department of Housing and Urban Development and Florida Department of Children and Families have information about what homelessness actually looks like here in Pinellas County. And they can then compare that information to communities across the country. Data that we collect during PIC shows where folks are experiencing unsheltered homelessness, how many folks are experiencing unsheltered homelessness, where folks are, what folks' actual needs are, the causes of homelessness, things like that. And then we also have a housing inventory count that goes alongside that. So don't worry, as we're going out there and we're surveying our unsheltered neighbors, our neighbors experiencing sheltered homelessness are also being included in that data, in that report. So our 2024 point in time count, that took place on January 25th of last year. You may know on January 30th, we of course had the 2025 point in time count. I don't have numbers to share for that yet, but I do have the 2024 data to share with you. So in 2024, we found that there are at least 2,110 people experiencing homelessness in Pinellas County on a single night. And we say at least because those are just the folks that we're able to talk to. I don't know about y'all, but if you stand in a room of 1,000 people, you're not going to talk to everybody in that room, no matter how hard you try. So it's important to remember that this is a count of at least 2,110 people experiencing homelessness in our community on a given night. 721 of whom are experiencing unsheltered homelessness. What's the difference between unsheltered homelessness and sheltered homelessness? Well, shelter. So unsheltered homelessness, that's going to be folks who are sleeping in cars, on the streets, at bus stops, abandoned buildings, places not meant for human habitation, okay, in their car maybe. Sheltered homelessness are going to be our friends that are staying in emergency shelters, transitional housing, and places like that. We, of course, also include folks who are in DV shelter in this domestic violence shelter in this count as well. Also included in the PIT report, but not reported to HUD because it doesn't meet HUD data standards. That's okay. We included in the PIT report because this is a really important way of getting a full picture of homelessness in Pinellas County. It's Pinellas County Jail and Pinellas County School data. So Pinellas County jails reported 152 people sleeping in Pinellas County jail on the night of January 24th into the night of January 25th of last year, who did not disclose a permanent address at booking. Okay, these are folks who did not say that they had a permanent address and did not, as they left the jail, say that they had a permanent address either. Also, anybody that was moved into a different facility out of county was also removed from this count. Our school data, it's a really big one. August through January of last year, 3,555 students in Pinellas County schools. And this is data sent to us by Pinellas County School Board. So this does not include every single school in Pinellas County, as we all know. 3,555 students were reported experiencing homelessness. The difference between this and our PIT data, the reason that we don't report this data to HUD is because It's a little bit different. This is a cumulative count of homelessness. So if a child or their parent reports homelessness or couch surfing at the beginning of the year or throughout the year, they are added to this list and to this count. So that is student homelessness here in Pinellas County. Also worth mentioning, this number, 3,555, is only including the student. That does not include their brother, their sister, their mother, their father, their grandparent, whoever their caregiver is. That is only the students experiencing literal homelessness or major housing insecurity. I think that's a really important thing to know. As we move on to the next slide, you will see a trend of homelessness here in Pinellas County, unsheltered homelessness here in Pinellas County, as found in our point in time counts from 2016 and 2024, excluding 2021, because of a little thing called COVID. And you can see how unsheltered homelessness has changed here in Pinellas County over the years. We have sincerely reduced unsheltered homelessness in Pinellas County since 2016. But as you can see, there was an uptick between 2023 and 2024. And we're waiting to see what this year's numbers report. We are waiting to see what 2025 looks like compared to this. How have the hurricanes impacted homelessness in Pinellas County? How has Florida's anti-camping law impacted homelessness in Pinellas County? This is some of the data that we're going to be able to review when that 2025 report comes out. Next. We also, next up, have a quick thanks to everybody who participated on January 30th. On January 30th, 307 volunteers went out and surveyed their neighbors. That is awesome. Thank you so much for that. I also, in part because she's here, I'd like to think I would do this otherwise, but can everybody please give a round of applause to Chair Dominique Randall, who led this year. Ms. Dominique Randall with Pinellas County Human Services and the entire Pinellas County team, especially their BTS team, was really important and helpful for this year's count. We're super grateful for them. So thank you for that. And thank you to everybody who participated. If you want to see a little bit more about PIT and whatnot, you can of course scan the QR code on the screen. As I promised, the data dashboard is available on our website as well. If you go to pinellascoc.org/PIT, there will be a link to that data dashboard and you will be able to see 2024 data as well as reports from years past. All right. Now for the annual homeless assessment report to Congress. This takes PIT across the country and compares them. So how does Pinellas County compare to communities across the country? It's worth noting, okay, as we look at this, we are not comparing ourselves to major city continuums of care. We are not looking at how does Pinellas County compare to San Francisco or New York City. We are, however, looking at how Pinellas County compares to other mostly urban continuums of care. What on earth does that mean and who is that? Those are going to be continuums of care that include Anchorage, Spokane, Reno, New Orleans, Tallahassee, places like that. I would think it's really important to know that because otherwise mostly urban COCs is kind of gibberish if you're not sure what that means. So that's what that means. And as we go on to the next slide, you will see in HUD's 2024 annual assessment report to Congress, overall homelessness breaks down by state. And you can see here that Florida reported 31,362 people experiencing homelessness. There are also over 16,000 people experiencing unsheltered homelessness. Almost 14,500 people experiencing sheltered homelessness. In Florida, there are 7,563 families with minors, so people under the age of 17 in that household experiencing homelessness. And there are over 2,300 veterans experiencing homelessness in our state as well. In Florida, you can see that homelessness did increase 2% between 2023 and 2024 in our state overall. But if you look between 2007 and 2024, overall homelessness in Florida decreased over 34.5%, 34.8%. This was pretty consistent with that trend report that we were looking at earlier, doesn't it? That major decrease, but then we saw a slight uptick between 2023 and 2024. So that is just what this is. You can, of course, do the next one too. Scan the QR code to view the report online. Next slide, Megan. This year's AHAR did not include some of the awesome tables and graphics I think that yours past have. So I sifted through a really big spreadsheet to put this information together for you so that y'all don't have to sift through that spreadsheet. How does Pinellas County compare to other places? In Pinellas County compared to other mostly urban COCs in the United States, not just in Florida. Pinellas County has the fourth highest rate of overall homelessness, with at least 2,110 people. Of that, as we talked about earlier, 1,389 are experiencing sheltered homelessness, 721 experiencing unsheltered homelessness. When it comes to individual homelessness, that was 1,595 people. We rate 6 compared to COCs across the country. When we are looking at family homelessness, 515 people. And we rate, compared to communities across the country, 2nd in family homelessness. And this is, by the way, consistent with last year. Veteran homelessness, 231 veterans experiencing homelessness in Pinellas County. In 2024, we had the highest rate of veteran homelessness compared to other mostly urban COCs. For people experiencing homelessness under the age of 18, we had the highest rate in the entire country, and it was 351 people. 281 of those people were identified as experiencing sheltered homelessness, where 70 of those children were identified as experiencing unsheltered homelessness. When it comes to ages 18 to 24, we ranked 10th in that comparatively, with 89 people. When it comes to those over the age of 24, and this is going to be from age 25 to 105 or 106, we rate 4th comparatively, with 1,670 people reported experiencing homelessness. And then senior homelessness. Worth noting, if anybody's checking my math, senior homelessness is included in that over 24 category as well, but I thought it was important because this is a growing population here in Pinellas County. So people over the age of 65 identified as experiencing homelessness, 208 people here in Pinellas County. And that rated 4th compared to communities across the country. Also, I think it's really important to look at the National Low Income Housing Coalition gap report. Because they haven't released a new gap report since last year, I'm going to speed through some of this information because some of y'all may have gotten it last year. But the gap report shows a breakdown of housing affordability compared to how much people are actually making. You heard them talk about Alice earlier, those asset limited folks. They're actively working. That's going to be a lot of what we're seeing here, because housing in Pinellas County, housing in Tampa Bay, is largely unaffordable. We are in fact the 8th most severely cost and rent burdened metropolitan area in the entire country. I'm not talking about compared to Spokane. I'm talking about compared to any community in the country. Tampa Bay is rated as the 8th most severely cost or rent burdened in the country. We'll go to the next slide. You're going to see that we talk about area median income a lot here. This is part of what was talked about earlier as well. Area median income is just standard incomes set by the government, and if you fall within, if you're one person and you had an income of $20,100 or less in 2024, you were categorized as extremely low income. If you were one person and you were making, let's say, $31,200, if you were 4 people and you're making $31,200 annually for the household, you are still categorized as extremely low income, okay? If we are a 4-person household making $76,400 last year, we are categorized as low income, okay? So it's important to note that that's what the AMI is, as we go on to the next slide, because there's going to be a lot of talk about it. The gap report compares AMI, and rental affordability. So at people who have a medium income at or below 100% of that AMI, there are 89 affordable and available units for every 100 households in need. Okay, and this is for all of Florida. But for our extremely low income folks, there are 25 available and affordable units for every 100 households in need. Next slide. And you can kind of see here, actually, can you hit the thing 4 more times? You can kind of see, oh, nope, sorry, I lied to you, just 1 more time. You can see here the actual breakdown of cost burden, that's going to be the blue, versus severely cost burden, that's going to be the yellow. And that means that of our very low income households, they make 31 to 50% of that area median income, 57% are severely cost burdened. Of our middle income, they make 81% to 100% of that median area income, or area median income. 47% are cost burdened. Huge number of folks in our community that are cost burdened. What do you say? A huge number. Okay, can we go to the next slide? But you saw it earlier, 25 available and affordable units for every 100 extremely low income households in need in Florida. In Tampa Bay, there's 21. So Tampa Bay is unfortunately below even that state average. And as I mentioned earlier, we are the 8th most severely cost burdened metropolitan area in the entire country, or at least in 2022. We can go on to the next slide. So that is some data. I just threw a lot of data at everybody. And if you are a data person, you're really into numbers, I had a lot of fun looking at that spreadsheet. But if not, it's okay. There's an opportunity to ask questions. Also, though, there is another thing really impacting our community here. Y'all might have heard of this thing called the anti-camping law. It is also known, of course, as Florida House Bill 1365 or Florida Statute 125.0231. So I don't think anybody except for me is actually saying that. But what on earth does this law mean? This law has ensured that no community in Florida can allow public sleeping or public camping overnight. No sleeping or camping on public property in Florida overnight. Now, of course, if you are parked legally in a legal spot with a legally registered vehicle overnight, time allowed and everything, that's legal parking and you are allowed to sleep there. If you are at a campground, you are checked in at a campground, you're allowed to sleep there. But for instance, if you are sleeping in a park overnight, that is officially not allowed. And come January 1st, local residents and businesses were given the right to sue governments, so the counties, the cities, for allowing overnight sleeping, okay? So this is something that is really impacting our community. Folks are afraid of where will I sleep tonight? And communities, local leaders are afraid of how do I help make sure that people are taken care of, because I don't want to criminalize homelessness, but also how do I make sure that my city or my county is protected from lawsuits? Because we can't help anybody if we aren't making sure that we are protecting ourselves in a way that we can actually continue to help people. And it is a really, really serious question that the CoC has been grappling with. The CoC created a task force that started meeting last year and continues to work to try and identify possible solutions to this question. Because it is a really, really healthy question. How do we ensure that members of our community feel safe and have somewhere to go when the government in Florida has created this law here? And it is absolutely impacting members of our community. So this is a little bit of what's impacting homelessness here in Pinellas County. And folks who participated in January 30th point in time count can give you firsthand stories about how they saw this law impacting our services and how our community feels. Because for the first time since I've been involved in this event, folks were actually saying, no, thank you, I don't want to participate, I don't want to do your survey because of this law. I've never heard something like that before. In 4 years, I've done the point in time count. So this is absolutely something that the folks that are within our system of care are concerned about, and the leaders within our system of care are concerned about. So this, by the way, will take you to that statute in case anyone wants to read the actual statute. But that is Florida's anti-camping law, and that is a really quick overview of the state of homelessness here in Pinellas County. Megan, can I go over and we have a moment for questions? Okay. There is, of course, a larger area for questions afterwards, but before I move on to, or before Chair Beckman moves on to COC goals, does anybody have any questions about that?
Thank you for that. My question is, when you were showing the statistics rating Tampa Bay as fourth largest or highest, out of how many communities? Is that it's four out of 10, 4 out of 100?
Great question. I'll be honest with you, I do not know how many mostly urban COCs there are, but I will tell you that every community in the country has a COC. So a lot. And that's a good question. And you know what? I thought about doing the math last night, and I'm sorry if I didn't do that. But this is compared to communities across the country, and every single community is part of a COC. So this is quite a large sampling.
Just that statistic, those numbers would be more impactful.
Yeah.
It's 4 out of 168 communities.
Yes, probably that's. I'll tell you what, before we post this slideshow online, I will go back, I will do that math, and I will add it to those slides just to be sure. And then when we send this follow-up out, we can also ensure that that is clearly stated in the email, because that's a great question and deserves a really serious answer. Thank you.
Question, thank you. Real similar to that one. How confident are we that when you identify our COC does that count, that other COCs you're comparing us to are putting the same effort and the same standard methods of counting to get to that number? Because saying a fourth out of whether it's 100, 130, or even 50 is kind of a scary number. And then secondly, can you just briefly help me better understand when we do a point in time count, how does weather and the number of volunteers that you have committed, I think you said 307, and that's a great number and exciting. What if there was 250 last year? Do you cover more people, find more people, and does that affect the numbers that are given?
Great questions. So I will tell you right now, I do not do the comparison. HUD does that. HUD does that just to be sure that they are comparing it accurately. And when we, for instance, submit our data to HUD, we have to provide methodology. So HUD takes into account things like, have you changed how you are doing your pit collection? Has something major changed within your community? And so we report all kinds of changes, including weather. This year we changed our incentive. We will report that to HUD as well, so they can take that into account. And the AHAR, that report that HUD puts out, actually shows sometimes that specific communities are removed from the report overall for that year because they changed methodologies or something like that, and it just could not be compared accurately. So to answer that question, I don't do it, but I do rely on HUD for it. The second question, how does weather and volunteer support impact PIT? That is something that we really had to grapple with this year because of the hurricane Joel might have heard of. It looked a little different this year, and volunteer recruitment started later, and there were fewer people to participate. So I can tell you right now that in 2024, we deployed 396 volunteers to complete surveys. In 2025, we deployed 307 volunteers to complete surveys. What we did to try and make up for that difference was really, really dig into our deployment areas. And some areas were combined so that volunteers could, for instance, cover a larger section of, ground instead of being confined to that small area. So we do really work to try and make up that difference. But in communities across the country. This is in large part really dependent on the number of volunteers and support that you can get. And it looks different in communities all across the country. I was saying to somebody today, one of my favorite things to do at conferences is go up to people and be like, who does y'all's pit? I need to know everything. Because it looks so different throughout the country. We have partnered with law enforcement, we have partnered with our county partners, with our municipal partners to try and make sure that we are getting to as many folks as possible. And then some of our partners, including some of our HLA staff, some of our partners at Ready for Life, some of our partners at Directions for Living, I think even some of our partners at the VA, they also do a couple of after pit surveys the day after pit over the phone. And we do those, kind of has really specific rules about how you can do that. So we follow those really specific rules about how you can do that. And they go ahead and they complete phone surveys with, for instance, as many families as they can on our family by name list. So we do try and come up with creative solutions to fill in gaps because we are as strong as our workforce is or as our volunteer base is. And the more volunteers on that note that we can get for January of 2026, the better. Go ahead and start telling your friends and families about it right now. Tell your adult children, your spouses, that you are volunteering them to do PIT. It's a great activity. It is such a unique opportunity to talk to our neighbors experiencing homelessness, to have a moment outside of ourselves to learn from experts. I can talk to y'all about homelessness until I'm blue in the face, but I am not an expert. And the opportunity to talk to and learn from experts. The reason that Mr. Small here is the co-chair of our Lived Experience Advisory Committee is because he is an expert where I am not. And that is such valuable interaction and data and partnerships. So tell everybody you know to participate in PIT in 2026, please. All right. I think that is probably all the time we have for this, so there is an opportunity for more questions and answers at the end.
Thank you. That's a lot to follow. I'm familiar with that data. I enjoy looking at the data. I don't like what the data shows, but it's really striking to look at how many line items Pinellas County is in the top 5 in the nation. It's just, I think we're in the top 10 for everything, but the top 5 for a whole bunch of categories. And I appreciate, hopefully, they might even get the answer to how many comparable, what do we call moderate urban COCs, but I bet it's at least 100. And you know, other data is the state of Florida is like in the last 5% of spending on mental health, social services, substance abuse out of the nation. And so you look at what our legislature, what our state puts their money to, and then you look at those numbers. I mean, it's not a big jump, right? So that's part of it. I'm going to talk about our CoC goals. And so the continuum of care, again, we went through that whole board of directors, all the different representatives who sit on our board of directors and work for oversight, developing strategies, setting priorities, allocating funds. That's our job. And we work with a lead agency, which is the HLA, who does all that work. And so we serve as oversight and setting policy. And the CoC has specific goals this year, and these are things that we're looking forward to in 2025. I've been a member of the CoC for about 5 years. It'll be 5 years in April. I became engaged with it when I was served on the Clearwater City Council, and it was a board that I chose and was excited to be part of. Right now, we're happy to have Councilmember Menino from Clearwater serving on our board, representing Clearwater. And through that time, I served on the board, and then I worked I became part of the executive committee, then vice chair, and now I serve as chair. During that time, our lead agency has always been the Homeless Leadership Alliance, and they've had a number of CEOs over that timeframe. People come and go, and they move on to different positions. We also worked through COVID, which was a challenge in 20 and 2021. We've had numerous hurricanes and challenges, but we are here, we are strong, and we are committed to the work, and the work is simply reducing and preventing homelessness in Pinellas County. That's our big goal. And that remains constant, and that's why we're all here. But for 2025, what we're looking for is to have we really want to work with the HLA and help them secure a permanent CEO that will continue the good work that we are all doing. And it's good to have consistency in developing relationships, setting priorities, and developing key guiding documents. When you have new leadership frequently it's harder to get your feet grounded and move forward at a fast clip. So it's important to have in place a permanent CEO at our lead agency. Right now, they have an appointed interim who is doing the work. We want to complete a gaps analysis. And I'll talk a little bit about that gaps analysis in the next slide. We want to complete a CoC, strategic plan with measurable goals. It's always important to have measurable goals. We want to increase participation in our lived experience advisory committee. Our philosophy is not about you without you at the table. And that's why we have a lived experience advisory committee co-chair who serves on the executive committee. Whoops, one more time.
Do you want me to go back here?
Yeah, just a little bit.
Sorry.
That's okay. We want to strengthen our relationship with elected officials. Why? Because elected officials have, the biggest platform for disseminating the information, sharing all those shocking stats and figures with their constituents, with their peers. And that's important because funding can come through elected officials. They need to know the facts and the data, where the gaps are, and where we rank, in the state and nationally. We want to build community partnerships and really thinking outside the box. I personally think that there's great opportunity in engaging more faith-based leaders and community members in the work we do. There are other nonprofits out there. You saw that we're first in the nation with homelessness of people under 18. Perhaps we want to engage youth organizations. There's all sorts of, thinking outside the box, bringing diverse people to the table, because this struggle with either facing homelessness or experiencing homelessness touches everyone. Everyone, whether you're a business owner, whether you are, a parent and you have young adult children that are going out trying to find, get their footing, get their job, find housing. Your students, college students, all that stuff. Elderly who are, are being priced out of their housing due to insurance costs, other things, HOA fees, all that business. It's impacting everyone. We need everyone at the table. And then again, the goal is always to work to reduce and prevent homelessness. So if you want to go to the next slide, we'll talk a little bit about a gap analysis, because this really has to come before we look at our strategic plan, or developing a strategic plan. And when you look at that data that Victoria went through, veterans who are homeless, individuals who are homeless, families who are homeless, youth who are homeless, elderly who are homeless, we see that, man, there are gaps all throughout the continuum. And so a gap analysis simply compares the current state of available services and resources for a problem, and that was what we had 21 homes per 100 people for moderate income. All right, so we look at the current state of available services with the ideal or desired level of care or availability of housing, rental housing, housing to purchase. We identify the gaps or shortcomings in the system to guide our planning, to help our goal setting, and our resource allocations to address our most pressing needs, or those needs that aren't served by other organizations. Often a consulting group will conduct and report on the findings of a gap analysis. This takes a professional organization that comes in, surveys an entire community, looks at data, and develops a gap analysis report and some recommendations. Next. So this is a goal to complete this in 2025. The next one, this is just some examples of what, of needs a gap analysis might show. And I'll tell you, in Pinellas County and, what was it, our last Funders Providers Council, we had a woman from, I don't know if you might remember, she's a consultant. She works with the city of Clearwater. She works with the county, developing comprehensive plans and things like that. She was there to get our feedback about what pressing needs were in the community. And quite frankly, everything is a pressing need. I mean, I'm just telling you, it is. And so, you know, our gap analysis will probably show we have insufficient mental health providers or limited access to specialized care. It's a no-brainer. We have a housing crisis. We need workforce housing, affordable housing, permanent supportive housing, elderly housing, transitional housing, domestic violence shelter. We need it all. But we also need the data just to prove it as far as these are the numbers. Maybe we have limited outreach to specific populations. Maybe we're missing those youth and children aging out of foster care, all sorts of nuanced different populations. Okay. And then when we know where our greatest needs are, what that gap analysis is, then we'll develop our strategic plan. This is a goal of the CoC. And so we use all that data, a lot of that data that Victoria went through, information from a gap analysis, people, our board of directors members who have intimate knowledge with all of those constituents and people they interact with and represent at the table. And then we'll develop a strategic plan. And the strategic plan is this roadmap for improving the continuum of care by addressing identified gaps with measurable goals for making progress. Does it mean that we fail if we don't meet a measurable goal? It means that we strive for that measurable goal, and if we make it, that's phenomenal. If we don't, we need to answer to that. What were the hurdles to achieving that measurable goal that we had agreed on? Okay. And did you have that little graphic this time? I like that graphic. Oh, I didn't put that graphic in there. But thank you. It is always important to have people with lived experience at the table. People who have experienced homelessness, people who have maybe children or parents that are experiencing homelessness, whatever your connection is to homelessness. We need those people who know exactly what it's like in that particular situation. Every situation is different, but their voice is so very important at the table. So another goal is to increase our participation of people with lived experience in all of our committees, during our board of directors meetings, and I'm so proud that we have Michael, who serves on our executive committee as a person with lived experience. Strengthening our relationships with elected officials. I mentioned that earlier when we went through what I was going to talk about, but it really is important because that's where funding comes from, because they can affect policy. They can go to Tallahassee, talk to our state representatives. We can include our state representatives in our CoC, advocate for legislation, help them shape legislation, participate in that whole governance. We need to have relationships with federal, state, and local elected officials. Ideally, we would meet regularly with them, maybe quarterly, one-on-one, to update them on what we're doing, what our challenges are, what the data shows, and what they can do to help. And then building community partnerships. This is where I think we have great opportunity. And this is thinking outside of the box. And I was thinking, who interacts with people who are struggling or facing homelessness? I know as an elected official, I would get emails, calls. I'm going to get evicted on Friday. What can I do? What resources are there? You know, it's hard to offer a lot of hope when there's like a 2-year waiting list for permanent supportive housing. But we need to think outside the box about partnerships and bringing these diverse voices to our table in the CoC, churches, other nonprofits, teachers, medical professionals, and first responders who are face to face, looking at people struggling, you know, face to face with tears in their eyes, like, I don't have anywhere to go home tonight. You know, if a student tells you that, or my mom lost her job, or the car got repossessed, or whatever. It's like, what resources do we have and how can we make things better? Veterans groups need to be at the table, and youth organizations, for sure. I think that's, like, one more slide? Okay, so any questions or suggestions, about the CoC goals are, getting, you know, secure, ongoing, leadership at the HLA, consistent leadership, gaps analysis, strategic plan, and in community engagement, thinking outside the box, elected officials, improving those relationships. Any questions or additions? Councilmember Menino.
Thank you. Sorry, I don't mean to have questions. I don't mean to have questions every time.
No, I love questions.
And I appreciate, I'm a data information guy, so, and that's why I'm here again asking some of these. In your opinion, when we do a gap analysis and that feeds into a strategic plan, how often should we as an organization or you as an organization be doing that? I know it's obviously, you stated a goal for 2025. When was it last done and how often do you think going forward it should be done?
I would think it should be done about every 3 to 5 years. If we have some big incident that happens like COVID that might cause a blip in how frequently they do that, that would be good. And I don't know the last time it was done. That's something I'm working with our lead agency about a strategic plan.
And then lastly, I think building community partnerships is obviously very important for any community organization. When you talk about increasing and strengthening relationship with federal, state, and local officials, I think so often, you know, when I have discussions with so many of them, what they want to see is measurable results. What do those numbers look like? If we're spending X amount of money, what are the results getting us? Are the numbers better? Where in these goals do we show that accountability measure? And how do we face that out to the public, like those elected officials?
I think that's a great question. I think data dashboards are really important. We do have a homeless, HMIS, homeless
Management
management
information.
information system, data that is publicly facing, that people can go in and look at that. But I think dashboards are there to show what are those goals, have we met those goals? I think that's how I operate as well. And that's the goal, to tie it into the strategic plan. Mhm.
Oh, I did want to just, since Chair Beckman mentioned it, I did just want to note that if anybody is curious and wants to see that HMIS data dashboard, you can go to pinellascoc.org. And it'll be up right here at the top, data dashboard, and you can actually see some of those, some of that system level information. Oops, sorry, wrong one. Here we go. Yeah, some of that system level information will be listed here as well, just in case anybody's curious and wanted to see. Sorry, Trebek, I didn't mean to hide that, just wanted to show that.
Oh, good. And Mr. Stan Picard, who's right behind you a little bit, is chair of the Data System and Performance Committee, and he's a whiz at that. And HLA hires, they have a specialist that manages HMIS, and so you could communicate that person as well.
Yeah, not that I need to know, but I think it's
Yeah.
important to share.
Oh,
And
absolutely.
if there's milestones, if we're truly making effects and changes in our community, we should brag about it. And we should
Absolutely.
show it. And
Absolutely.
when you have successes, more people get involved and want to be a part of it.
I fully agree. Thank you. And that's part of the intention of 2025, really is. All right, thank you very much.
Just a quick overview, a little bit of information about CoC membership. Megan, if you could take us to the next slide. Okay. So y'all may know this already, but the CoC is made up of any individual in Pinellas County that wants to help end homelessness. If you are an individual or an organization that serves Pinellas County, works in Pinellas County, lives in Pinellas County, or goes to school in Pinellas County, there is an opportunity for you to get involved in the Pinellas CoC. CoC members include nonprofit organizations, hospitals, transportation-based organizations, veteran-serving organizations, recovery organizations, organizations that help survivors of domestic violence, local governments, elected officials, individuals with lived expertise. I could go on all day, by the way. A lot of people are part of the CoC. So if you know somebody that should be part of the CoC and isn't, there's an opportunity for involvement. Megan, if you take us to the next slide, I'll show you how to do that. No, I won't. I lied to you. Instead, I'm going to show you a little bit more about membership. So CoC members elect and serve as leadership in the Pinellas Continuum of Care. We had an election for CoC leaders just on January 10th. Thank you to everybody who participated in that. We share resources and information. Providers probably got the providers newsletter that Megan sent out on Friday with some critical information in there. If you didn't get that in your provider, please let us know so we can add to the list. We, of course, have opportunities to share volunteer opportunities. If your organization needs volunteers for something, please let me know. There is even a form Megan and I can send to you so that you can let us know what your volunteer needs are so that we can share that with the HLA's volunteers. I have volunteers that want jobs, y'all. Please give me jobs for them. We, of course, also have networking events and training opportunities. Last year, we started, for instance, a trauma-informed care training series. It was a 5-part virtual series. It was open to all CoC members. And by the way, if your organization is a CoC member, that means your entire staff can attend these trainings. Receive funding and advocacy alerts, and serve on critical boards, councils, and committees, which we'll talk about in a little bit. Membership, what does that actually look like though? We have memberships that start at $0 and go all the way up to $500. If you are an individual, the most that you will pay for a CoC membership is $20. However, if you're under the age of 24, or if you've experienced homelessness within the last 7 years, I'm not going to ask you to pay 1 penny. If you are an individual who doesn't fall under one of those categories, but you need some assistance, this isn't supposed to be prohibitive. We have scholarships available. All you have to do is indicate that you want a scholarship on your membership application. And I'll be honest with you, for individuals, I ask no further questions because there are a lot of questions that get asked throughout life, and this just doesn't need to be another one of them. I don't need some sort of certification or anything like that. If you are an organization, at last year's April meeting, there was the idea for better involvement or more opportunities for involvement for organizations that were not faith-based, nonprofit, government, or for-profit agencies. Turns out there was a gap in our CoC membership for grassroots organizations. And because of this meeting, which we actually held at Safety Housing Authority that day, we went back and the board in May, so it was only a few weeks later, voted to add grassroots advocates. So if your organization doesn't fall under one of these categories, there's a $50 membership available to you as well. Sliding fees are available too. If you are a nonprofit and $300 sounds prohibitive, because it can sound prohibitive, that's okay. If your organization has fewer than 5 full-time employees or an annual budget under $500,000 annually, you might be eligible for 50 to 100% off of your annual CoC membership fee. So there are plenty of opportunities, and we are working to make this as inclusive and available as possible. On that note, if you have suggestions for how we can make this more inclusive, please let us know, because as Chair Beckman said earlier, we want everybody to be at the table. And not everybody's accountable will think that what I think is easy. Not everybody is going to be able to access the same resources or pay the same dues or attend the same meetings. So please, if you have insight on how we can improve this for our community, let us know, because that's what we want to do. Next. Here we go, you can hit it one more time. You can always go online and view membership brochures which are available up front and CoC membership applications, which are due between January 1st and December 31st. Please make sure if you have not joined the CoC since January 1st, you go ahead and do it. That means, yes, if you completed your application in December so that you could, for instance, qualify for the entire 2024 membership or vote in our January 10th election, you do still need to do it again because that was for 2024. And I will ask you to do it again this calendar year. You can scan that QR code or go to PinellasCoC.org/join. Next slide. Okay. Now we'll talk about CoC boards, councils, and committees. Chair Beckman, did you want to say a little thing on the board meeting?
Okay, so our CoC is made up of different boards, councils, and committees. Members that are on our CoC board of directors are required to participate, strongly encouraged in one of our committees or councils. Our board of directors makes policy decisions on behalf of the CoC by evaluating needs, implementing strategic responses, measuring results, and approving funds. We meet every other month, and it's hybrid. The executive committee is just as it says, it's made up of the chair, that's myself. My vice chair is Councilmember Deborah Fig Sanders from St. Pete. Our secretary is Directions for Living CEO April Lott, and our Providers Council chair is CEO of Holy Centers, Kevin Morone. Our lived experience board member is Michael Cretan, who is the lived experience co-chair Ryan Perry. Our Funders Council chair has a role on the CoC Executive Committee, but that position has been vacant for quite a while. And then the immediate past CoC chair was Sean King, who is got a new title, but he was like a legislative director at Habitat for Humanity. I think he's vice president or something. Congratulations to Sean, but he turned out. He served as the immediate past chair for a year. And so right now, there are just 5 of us. So that's the executive committee. The Funders Council is made up of people who represent funders. So usually these are governmental agencies, the county, municipalities, entitlement municipalities. Those are municipalities that are large enough that they get HUD funding, as well as some nonprofits like Juvenile Welfare Board who gives money, Pinellas Community Foundation, and there are other people that sit on the Funders Council. Again, the vice chair is Errol Woodard, and they meet every other month. The Providers Council those are the service providers. So those are the people who are in the trenches, doing the work of serving the needs of people who are struggling with homelessness or, fearing homelessness. The chair is Kevin Morone, and the vice chair is April Lott. The Advocacy Committee. So I chair that committee. My vice chair is Anne-Marie Winter, who is CEO of the Area Agency on Aging. And we meet quarterly, virtually, and we do just what it says. We work to advocate on behalf of the needs of the CoC. Our most recent meeting, we had a lobbyist from Florida Florida Coalition to End Homelessness. And he came and talked to us about the upcoming legislative session in Florida, some legislation that we may want to keep an eye on, and he'll give us regular updates about language changes and advocating that way. Data and System Performance Committee coordinates data from the Pinellas Homeless Management Information, HMIS, information system. It reviews data and system performance measures, informs best practices, and recommends funding priorities. And that's chaired by Mr. Sam Picard, who is here. And often if if that committee sees blips or abnormalities in the data, they will investigate what's going on, and work to correct those. The Lived Experience Advisory Committee, we call it the LEAP Committee. It advises the CoC board on services, programs, and the needs and concerns of people experiencing homelessness. And again, we talked about this throughout the meeting, but it's people who have had lived experience with homelessness. And Gary Smalls is here. He's co-chair with Michael Crichton. And the meetings are monthly in person. And then the PIT Planning Committee is kind of Victoria's baby and Dominique. And they work to coordinate that National Point in Time Count Day. It's the last Thursday of January. Is that kind of what it is, or?
Yep.
Last,
HUD requires that last 10 days in January in Pinellas County. We traditionally do the last Thursday in January.
and their meetings are monthly, August through February. And their chair is Dominique Brendel, who is with the county. She's here as well. It's a Herculean effort. And then the Systems Disparities and Equities Task Force is one that looks at, advises the CoC board on how to address identified gaps within the CoC system of care, looking at data and drawing our attention to certain gaps and helping us come up with ways to address those gaps and disparities that we see in the data. All good?
Yeah.
I think we're down towards the end.
We are.
Okay, so our future membership meetings are 5:30 to 7:30 p.m. on Tuesdays. You've got the dates there, May 13th, August 12th, and November 11th. Information sessions, Victoria has there. You've had a lot of good information sessions about different providers in the community. I will say that the HLA has done a good job most recently updating the CoC website. Looks very nice, with a lot of new publicly facing documents and updated documents, and it looks, but it's been easy to navigate, so I appreciate that. Thank you. I think that's it. So I want to, you can, join or renew your membership with that QR code. I want to thank you all for coming. Those who attended, thank you. Gary, did you have something to say, or are you just stretching your legs? No. You good? Okay. Any questions and answers here as we, wind down from the meeting? Anything else? Suggestions?
I did not receive any public comment cards. Did anybody fill one out if you would like to hand to me now? Okay. Wanted to make sure I didn't miss anybody.
Okay. Well, thank you to everyone who attended virtually. I appreciate that participation. How many attended virtually, Megan?
I think we had 25,
Same.
26.
25, 26, fantastic. Thank you very, very much. I appreciate it. All right. Well, I think we're good. I'll stay here around a little bit as people, leave if you have other questions. And you can reach out to me individually at any time. Thank you all for the work you do and for attending the meeting.
See it. They're all over the place.